Hi, I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery, and welcome to this video on diet and surgery. It's actually relevant to every aspect of your life, but this is a great visual of what happens when diet is bad or goes off and how it affects the surgical result and then how we fix it. This is a gentleman who came to see me and he had a very nasty tumour on his face, but this wasn't his first. I had to take out 3 others prior to taking this one out, and this is a big one, so it's a big hole as you'll see here. That is the appearance of the patient after having Mohs surgery for tumour removal. That's Mohs micrographic surgery. So the tumour's gone, but he's got a massive hole in his face. What to do? Well, what I did was I repaired this using what we call flaps, and flaps are when we move tissue around. And the reason we do that is because it's similar tissue, so you just move it around. That's a flap. The advantage is it's got a blood supply. So I actually thought he'd do really, really well. Fantastic, very happy, had flaps from his upper lid, flaps from his face, closed the hole, very proud. Look what it looks like when he comes back. What you're seeing there is black scar, and this happens when the flap loses blood supply. And this is really quite worrying. I thought I couldn't work out why it was so bad. And when he came back with his family, I asked questions to him and his family, and it turns out he drank a lot, didn't eat much, and was very nutritionally deficient and vitamin deficient. So instead of rushing back to surgery, we put him on a regime. Basically asked his family to give him 3 good meals a day, big doses of vitamin B, C, and vitamin D. Most people are deficient in vitamin D, and then gave it a bit of time for all that to kick in. When I did take him to surgery, I couldn't do his flaps anymore. We'd already used that option. So I had to do skin grafts, which is actually more difficult because skin grafts don't have a blood supply. And I thought we'd be in trouble. But after dosing him up with good nutrition, vitamins, getting him off the alcohol, and I got him mobile as well, this is what he looked like at 1 month. It looks magnificent. He had a good blood supply, it looks aesthetically pleasing, and it was well on its way to settling just nicely. It's a really good demonstration of what happens when you've got a poor diet and what happens when you've got a good diet, and manage your vitamins. And this is a demonstration with surgery, but it affects you in all aspects of life. So whether you're having surgery or not, really get yourself optimal. It makes a visible difference with surgery and a huge difference with life. I hope that all makes sense. Thanks again for watching. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney.